colleague, Wanda Lucas. Thank you, Wanda.
Thank you, Daniel. I want to, sorry, excuse me. I want to thank our
Wanda, I believe you're muted.
No, I unmuted. You can't hear me now? Can you hear me now? Okay. Thank Allison and Sarah for joining the panel. Welcome. I'll talk to Daniel. I was really excited about so many people that were interested in hearing about volunteering in the Washington, D.C. area. So I'm extremely excited about today's session. I want to say that I work with Daniel in the Kogod's Office of Career Engagement. And one thing I try to do with my students is to really get them to talk about their motivations, because I think that it leads them to having strong career satisfaction. And in my opinion, that career satisfaction is also involves having a balance in your life and using your talents, not just for work, but in volunteer or service projects. So I enjoy having those kind of conversations. And recently I was on a trip with students to Nashville, and I was very encouraged to hear so many employers talking to our students about having some passion about something else other than their career, really talking to them about being a whole person. So with that, I want to open up the introductions and ask both of our panelists to briefly introduce themselves, give your title, where you're from, and kind of summarize your volunteer experience or your connection to service. So let's start with Allison. Is that okay?
Sure. Can you all hear me okay? Okay, great. Well, good afternoon, everyone. My name is Allison Alonzy. I'm the current Director of Patron Experience at Strathmore in North Bethesda, Maryland. I reside in Arlington, so I'm not from that area. But I have been with Strathmore since December 2019, so I'm still new and learning about their volunteerism and all the connections they have with the volunteers there. But before I went to Strathmore, I was actually with Ford's Theater for 14 years. And in my position at Ford's Theater, I was very connected and built the volunteer usher program from the ground up. When I started there in 2005, we had maybe 15 volunteers. And by the time I left, we had a core about 1,000 volunteer ushers working with us. I also co-managed the historic site volunteer program, also known as Volunteers in Parks, which I co-managed with one of our National Park Service Rangers. So while I don't have a lot of extra time to be volunteering, I believe wholeheartedly in volunteerism and finding that passion, as Wanda said, which I know we'll delve more into. But being someone who manages and supervises and works with volunteers, it is really important to organizations to have those people involved in the organization as a support and as a way for folks to experience what they're doing, maybe for free or at low cost, depending on what the organization is. So lots more to come, but that's who I am.
Thanks so much, Allison. It's great to hear about your background and what you're coming with today. Good afternoon, everyone. My name is Sarah Beamish. I'm Assistant Director of Annual Giving in the Department of Alumni Relations here at AU. And outside of work, I volunteer for Children's National Hospital as a patient care volunteer. It has a bit of a confusing name. We talk about that a lot internally. It's not to do with anything medical or even, anything to do with their like physical health, but a lot of to do with their mental health and the well-being and the community we can surround our patients with while they're in a hospital environment. A lot of our time as volunteers is spent playing and talking and creating and hanging out. And all of that is the patient's decision. And that's one of the biggest lessons I learned as a volunteer at Children's, is that when you're in a hospital setting as a child or a patient, we work with everyone from a few days old to people in their 30s because they have had care at Children's as children, that it's about choice and consent. You don't get to choose a lot of things that happen to you in hospitals. And when I come in as a volunteer, when any of us come in as a volunteer, it's about what the patient wants out of that time. And that is just a wonderful, selfishly a very wonderful opportunity just to be present, just to be in a space where you have to listen and engage and just be in that moment. Alongside the patient care volunteering. I tutor in the oncology and bone marrow transplant units, and I also assist with their animal assisted therapy dogs. So I go around with their handlers and the little puppers, and we mostly visit during my time outpatient units. So those people that are just popping in for an appointment, but they can be really stressful. And that can look like lots of dog pets, lots of showing them how to give treats and give commands. It also can look like managing patients or adults, anyone who's visiting children that don't like dogs, and providing a distraction. I have many puppets in my smock for kids who don't like the dogs. So that's me for now.
Well, thank you both. I wanted to start off a conversation about volunteering or being of service by talking about how we personally define it. I know that I was pretty much raised to be of service. You know, I grew up hearing, you know, when you have, you give, when you can, you do, you know, very simple, giving of yourself. So how would you two define volunteering or being of service? I'm sorry, I meant to start with Allison again, I'm sorry.
Who's gonna go? Sure, I mean, I think my definition of volunteerism probably aligns mostly with what you just said, but I think it's offering like yourself, your time selflessly to a task, whether it's a one-off task or it's something you're passionate about and you're supporting the organization for a longer period of time. I think that there should be, when you're looking at volunteering, there should be no expectation of compensation, obviously, or benefits. I do know a lot of places look to try to make it as rewarding as possible, and sometimes that reward is just emotional and fulfilling for you emotionally, and sometimes it's a free, you know, beverage when you come or seeing a show for free. It just depends on the experience. So I think it's selflessly offering your time to betterment of whatever you're looking to do, and that's sort of how I would define it.
Yeah, I would agree. I think just linking back quickly to what I said, it's about being present, being able to offer yourself in a space that actually, for me, volunteering is not about me at all. There are a lot of benefits I get from it, but can you be in that place and listen and be present and, you know, remove your ego from it, just do what needs to be done. Because Children's National and lots of other places in DC, there are programs that just don't exist without people being able to give that time. But also noting that being able to give that time and space is a privilege. It's not accessible for everyone. And so my definition of volunteering is privilege too, because I can afford to do it. I can pay for my metro and bus ride to get there. I can access it. So all of those things in between.
Thank you, that was really good. So let's talk about motivations, because I always talk to my students about motivations, like what motivated you to get started with volunteering or serving, you know, keeping in mind, we all agree that there's no real monetary reward for doing so, but there are other rewards, at least I feel so. So what was the motivation? And if you could talk to that, and then tell me, over the years, has that motivation changed? Sarah, let's start with you this time.
Sure. So my older brother was a preemie baby, and I'm 4 years younger than him, but still experienced lots of time in and out of hospitals. I grew up in the UK, and I had a really positive experience. They became a really comfortable place for me because of the time that doctors, nurses, volunteers, child life professionals spent with me as the little sister, and recognized that has some emotional weight to it, being in that space and accompanying him. And a lot of time and energy went into David, which of course he deserved, but just being able to sit and play Lego or color or talk about how I'm feeling about that space. I wanted to provide a similar experience, and I always saw Children's National Hospital advertisements on the Metro. You'll see Dr. Bear quite regularly around the DMV, so I knew about it. And so when I moved here, I applied, and my motivation has changed in that I have learned a lot just to be quiet, that there is a lot of space in just understanding what people need and being able to provide that. You can come into a room with a child with the best intentions, pick the best toy, bring Candyland, and they just don't want to do it. And being able to pivot really quickly and listen and understand what they do need, that's my motivation now, just to provide happiness, unadulterated joy, be childlike, have fun, talk about boys, talk about girls, talk about people, whatever you need, just be in that space and bring it.
All right, thank you. Allison, what motivated you to be involved with volunteers, you know, and do you see things changing or maybe even seeing the motivations of your volunteers changing?
That is, am I unmuted? Yeah, that's a good question. I mean, I'll be honest, like when I started my career, sort of, you know, I started working at a performing arts venue when I was in college, and the folks I worked with were fellow students. And we had a few volunteers who were older that were part of like our team that would come in, you know, mostly for matinee. So I didn't get into this work with a passion for volunteers. I think it really grew when I went into my professional career at Ford's. And I really was tasked with growing this volunteer base because we as an organization really relied on volunteers to function. And we could not have shows without volunteers because our organization just didn't have the money or the funding to be able to pay that many ushers to be part of the organization in a paid way. So I think I fell into it, and I'm always grateful that I have. I think one thing about having volunteers is you're able to have this wide breadth of humans who come from all different backgrounds, especially in the DC area. It's so great to just have, you know, such a diverse crowd there. I do think in moving to Strathmore, one of the things that struck me about their volunteer program is that Strathmore opened in 2005, excuse me. So they've been open about 15 years, and a lot of their volunteers have been there since then. And we're starting to see a lot of the current volunteers get to a point where they're aging out. So we have our work cut out for us now to look at diversifying the volunteer usher corps anyway, whether that's, you know, I think that's diversifying in a variety of ways. You know, we want our staff and our volunteer corps to reflect our audience. And that's not always the case in organizations. So I do think even though, you know, it's great to sit back and wait for volunteers to come to you, I think it's important to also reach out and recruit volunteers that will shape what you want your organization to look like. So I definitely think with Strathmore, there's opportunity, not that there isn't with Ford's necessarily, but I think there's always opportunity to grow your volunteer base and to change what you're currently looking at. And I think, you know, we have the opportunity now that we're seeing a good number of our ushers start to age out. You know, we opened 15 years ago, if you started when you were 70, now you're 85, 90, you know, it's not something that maybe is as easy. And unfortunately, we'll talk about the pandemic, I think, later, but I think we're going to lose a lot of our volunteers who came often that maybe aren't comfortable being in public anymore, but we'll talk about that. And did I answer your question fully? I think I did.
That does. I have a follow-up question. You bring up some really good points I never thought about, you know, the impact of the pandemic. So if someone is interested in volunteering at the Strathmore, just out of curiosity, what kind of values do you look for in, you know, your applicants?
Yeah, I think that I wouldn't say that there's a very robust application process. I think we ask a few questions about why they're interested, if they have any other volunteer history. I mean, I think what we're really looking for is not only people that are passionate about the performances that we offer or what we're doing in the venue, but also people who are just in general wanting to support the arts. So if you start, I think it's important to have that passion for supporting the arts, because I think it's hard to volunteer in a performing arts venue if the reward you want is to only see the performances or be able to experience them, because sometimes you can't. And so if that's all you're in it for, that's not going to give you what you're looking for as a volunteer. And so I think you need to make sure that the expectations are mutually exclusive and you're both getting out of the relationship what you want from it. And I think being passionate about, you know, again, supporting the arts, having the time to do it, which sometimes for different people, evenings are harder, weekdays are harder. I mean, we have shows sort of all the time, weekends, weekdays, weekend days. So we do have a variety that we are able to bring in different people with different schedules and accommodate them, you know, based on what their schedule allows.
That's helpful, and I'm glad you shared that because I used to want to be an usher at Arena Stage for the sole purpose of seeing all the plays. So now I know I shouldn't approach it that way. Thank you.
Well, it depends on the organization, and if they have the seats, they will seat you. And you know, as I talked about before, some of the perks is that for many shows we do our best as a house team. Like our job as the house staff is to not only serve the patrons but to serve our volunteers. And so we do make a very concerted effort to make sure they're seeing the show in some way. But if you have a full sold out house, it's just not going to be a night where they can see it. So it's good for you to know that going into it, that maybe not all the time.
That is good. So thank you for that. Sarah, I wanted to talk to you about, I'm really, impressed with what you've shared about Children's National Hospital. We all know about the great things they do there. So how do you think volunteering impacts the way you conceptualize the word community?
Showing up. Truly, I think it's you have to be reliable for your community. You have to be willing to be present and take responsibility and take action. And if you don't turn up at Children's and you're not there, then there are a group of children and patients that just won't see someone, or there are caregivers that won't take a break and have something to eat or take a shower because they're consumed in something very emotional and physically draining. So for me, it was a really important lesson in that if you commit to something, especially volunteering in your employment, in your friendships and relationships in your community, showing up and listening and taking part and taking action is super important, because everyone does have a role in our community, and that can make a huge difference. And then also just that kids will make anything fun. There are so many kids who you think there's no way they're gonna make like this. I've seen Moana or Frozen so many times, and there are moments where I'm like, I cannot watch this again. But they make it really fun and make fun jokes and sing it in a different way. And you do see the fact that like humanity and getting in touch with your child side is never a bad thing to be. So let's also like listen to the little ones. I think consent, what they want to do is so important in how we raise our kids, and giving them a voice to tell us what they need and how we can serve them and volunteer for them just as adults in our community too.
You bring up some really good points. I know for me, when I think about community, I belong to so many different communities because I think community is being around like-minded people or people that share a common goal or purpose. So, I just have all these communities in my life and I feel really blessed by that. So I'm grateful. So community is a word I use a great deal. I'm grateful that I belong to different communities because I feel I'm rewarded or I'm better because of these different communities I'm involved with. Let me ask this question to both of you all. Sarah, as a volunteer, and then Allison, as someone who manages volunteers, how do you help people, or how do people make time for volunteering? Because, it can consume you, and especially if you're working a full-time job. So, Sarah, how do you manage that? And then Allison, do you get involved with helping others manage that?
Sure. So I would say start small. Don't overcommit. It's really easy to be super enthusiastic about something and think that you have 6 hours in a week to do it. And the truth is that your mental, physical health, taking time off is just as important. So I'd say just 1 or 2 hours makes a big difference. And also know that community people do show up. There are over 350 volunteers at Children's National. They all give 2 hours a week. You can understand the impact of what that looks like. So also, realize that people are there with you, and people are there with you willing to give that time. And you being energized and refreshed and being in as best a place you can be physically and mentally for those 2 hours is better than spending 6, 8, 10 hours strung out and not feeling great. And then also AU is being great. I get a little bit of flexi time around the day when I was physically going into children's. I could just work a little tiny bit earlier. I passed that with my manager through HR just so I could leave to get there on time. So just ask for what you need and hopefully they'll be supportive.
Thank you. Allison, do people come to you or about managing the time for volunteering, and like how do you help them with that?
Yeah, so I think Sarah's right. I think take it slow, but I also think it's important for you to know what's expected of you when you're going into certain places. So everywhere is different. So Ford's, for example, asked you to usher 6 times per season. So 6 times total between September and May. Strathmore asks you to volunteer, I think it's 3 times a month when available, which is a big commitment. So part of my goal now that I'm at Strathmore is to grow our volunteer core so that people don't have to volunteer as much if they don't have time. I mean, as someone like, so we held an usher orientation during my first 90 days at Strathmore. And I would say one of the biggest conversations was about commitment. And we were more than willing to be flexible with folks as they were just getting started. A lot of people were saying they're away for the summer, maybe not this summer anymore, but in general, they're gone for the summer. And we're willing to work with them as long as when they're there, they're on time, they're happy, they want to be there and they're passionate. Like, we'll make exceptions and work with everybody because we need them. We need you to be there within, but we also don't want you to show up once a year for just the show you want to work and then never see you again, right? So we're going to put this effort and time and energy into training you. We expect you to at least work with us on your schedule and be open about the communication. I think it's very easy for people to be like, oh, it's just volunteering, I don't need to go do that. But as Sarah said, like we are relying on you to be there. And we're expecting this number of volunteers a night. If we get 10 less than that, then we're all picking up the slack just like you would in a job if a coworker didn't show up. So, we appreciate so much everybody who takes the time to volunteer so often with us now, but I'm hoping we can relieve them a little bit in the future as we grow the volunteer core more. But I think transparency and just being really clear on what you're getting into from the beginning, or saying to them, I can't do three nights a month. I can do 2. Can I still do this? Mm-hmm. And in my case, I'd say, of course, let's talk about it and figure it out.
Yeah. Okay. Thank you. That was good to hear. Expectations are very important. And I'm glad you stressed how a lot of organizations depend on volunteering or volunteers for their daily operations. And if you don't show up, they have to pick up the slack. A lot of people don't think about that. So thank you for mentioning that. Sarah, I have a question for you because you've spoken so passionately about the children. What would you say to someone who's interested in volunteering? I know you said start small, but there are different opportunities or different ways volunteering may show up. If someone wants to volunteer alone, or maybe with a group, or with their family, what advice would you give to the participants on this call?
I think work out what you're willing to do for free. There are many skills that we want to be valued for in a specific way, and there's nothing wrong with that. And so if there is a boundary or a comfort level that you are getting to, it's realizing, do you want to sit and being uncomfortable with that, and that's a good experience, or if that's something that's a hard no for you. If you're considering working with children, do you really like working with children? I've been vomited on, I've been cried at. That stuff is difficult, even for adults. So just make sure you enjoy the age group of people that you're interested in volunteering with, or perhaps it's not people at all. You want to be on your own and you don't mind doing quiet work. What skills can you offer? Do you want to be with family? Do you want to be with friends? Do they need you? I think that's a really important question to ask yourself. Lots of people are looking for places, and some places don't need the help right now, or they don't need the kind of help we can offer. And then what do you really want from it? What are you bringing from it? What's sitting inside yourself that you can bring to that place? Is it a good thing that you're going to bring? I have to be really careful before I go on a shift with children not to go in and I've had a really terrible day at work and be grumpy and not present. takes mindfulness to say, hey, I gotta leave that at the door. That's not something that belongs in this space. So realizing that as well, and then just look up resources. There are so many places that need our help, and there are lots of benefits for it if that's something that is motivating for you. And then the last thing I would say is just, if you're gonna work with children or work in a sensitive area, can you keep people's privacy? I know I'm a big chatterbox, and I have to remind myself of that all the time. There's HIPAA, there's privacy laws in place, but also boundaries. And it's really easy at Children's to think, I could hang out with them every single day, but we also want to show children really effective boundaries and not make promises we can't keep. And so I don't leave a conversation with a patient at Children's saying, I'll see you tomorrow, because I won't. And we want them to learn that when people say things to them, they're going to follow through on that. And I think that's so true to any part of life, that you're going to say something and follow through.
Yeah, I really agree with you about the children. I had an opportunity to volunteer in Peru about 4 years ago, and the person organizing the trip asked, provided some examples of volunteer opportunities, and I said, I don't do children. I just don't do it. So I think it's real important to know what your skills are, what you like to do, what you have to offer, and also understand that volunteering, shows up in many different ways. We were down to painting walls and serving food or whatever it was. So I think that's real important to know, like you said, to be able to set boundaries, know what you enjoy doing, because I couldn't hang at Children's Hospital. I know that. So, and I'm okay with that, So, Daniel, I was supposed to ask you if we have any other questions at this time.
At this time, we have about 15 minutes left, everyone. And thank you again to our panelists. Everything that you're saying right now, I'm taking notes, and you're reminding me of a lot of the great volunteer experiences that I've had in the past. So thank you so much. So there aren't any questions in the chat box just yet. We have about 15 minutes left. So if any of our guests on the call today do have questions, please make sure that you post those there. What I'm going to put in the chat box right now, however, and we do hope that people will still pay attention, but what I'm putting in the chat box right now are 3 different websites that anyone who's interested in volunteering may peruse. One of them is called 9 Ways to Help Others During the Coronavirus Pandemic, and that was published on April 21st. So it's kind of a general overview of ways that folks might give their time and energy. Another website that I posted there is called Volunteer Match, which allows folks to specifically find which city they'd like to volunteer in, which area. And it breaks down if you're volunteering as an individual, as a family, as a group. I think there's a couple other ways that you can break that down with teens, seniors, things like that. So just some considerations there. And then I also put the website for AU's Center for Community Engagement and Service. So our partners at CSES oftentimes all the time are encouraging our students to volunteer and serve here as well as across the nation, around the world. And they also have great opportunities for our staff members. So if you're ever looking for a specific opportunity or want to connect with someone, the Center for Community Engagement and Service is our colleagues there is a great place to start. So please, if you have any questions, put those in the chat box. But Wanda, I know that you've got a few more for discussion.
I just want to add that volunteering can be a one-day event. I know that the Center for Community Engagement has like a day of service around Martin Luther King's birthday. So your volunteering could show up in different ways. It could be a one-day event you do with your coworkers or your friends, or it could be a commitment that Sarah spoke about and that Allison looks for in her volunteers. The other thing I would say is, personally, I've done a lot of different volunteering. I've organized a family event where we volunteered at the Capital Area Food Bank. And what I loved about that is we knew what we were doing, like how it was going to impact the end user. So we were all in there together having different tasks, but we did it together. So we felt that we made this, concerted effort. I volunteer with an advocacy organization, and just so happens my volunteering required me to go into Capitol Hill one day, well, go to the Capitol. and participate in a press conference with all those cameras clicking. That wasn't part of my plan, but you know, I had to step in for somebody. So volunteering could look a lot of different ways. I lobby on the Hill once a year. So volunteering looks a lot of different ways. If you can donate blood, that's a way of being of service, you know. That's something else that, you know, I enjoy doing because I can. So back to my, you know, the way I was raised, if you can, you do. If you have, you give, you know. So I just want to open it up to see if Sarah and Allison have anything else to add for the participants on the call. Anybody? Sarah or Allison?
Sure. I will say that Strathmore, when we're looking for volunteers or we're about to host like an open orientation, we'll put it on the county website. So that might be another good place to look, is like whatever county you're in or area on that region's website, because organizations may post to it as another catch-all. Volunteer match is great. I know we used that when I was at Ford's. And yeah, I think also just if you find an organization that you're interested in, just email them and say, hey, do you have volunteers, or how can I volunteer? And some may say we're not set up to have that, and some might say, you know what, that's a good idea. Let us get back to you on how you can be our first one.
Sarah, you have anything else to add?
I would just say that there's probably something out there for everyone. Just go looking for it, and people will be extremely, extremely grateful. And you'll get so much from it, even if it's just 2 hours playing Lego with crayons. And if that's your thing, I hear you want it. It's definitely not everyone's thing. My wife always questions how I can spend so long doing it. And also to follow up on what you're saying, it doesn't have to be a long-term commitment. There are lots of people around specific times of year that need really acute volunteer help. And it's a nice way just to experience things one-off and then see what you like the most too. Kind of like, I mean, you can't really try many jobs on for size, but you can definitely try volunteering on for size.
Go ahead, Daniel, you gonna read our question?
Yes, so we do have one comment and question in the chat box here, talking about how there are many different causes and many different areas to volunteer, and that oftentimes when you have a good, a meaningful volunteer experience, you do want to share that with others. So this question from Chelsea is just wondering how to get more people or more new people to catch that spark, to really understand, I guess, that feeling that you have once you've done an act of service.
Okay, well, I'll just jump in really quickly. I mentioned Peru. I didn't work with babies, but I worked with teenage girls who'd been rescued from human trafficking. So that was not a population I was used to, but what I learned was resilience from them. And I mean, they just blew my mind with how they were willing to welcome us and show that they could get through the situation. So I would say to help people get the spark, sometimes you have to invite someone, bring them along, say, look, you're good at this. This place can help, you know, you can help with these skills, or they need help. Just come and see what I see. Come and feel what I feel. So I think it starts with the invitation, and also sharing what you've done, how easy it is, and what you've gotten out of it. Sarah, Allison?
Yeah, in my experience as a coordinator or supervisor of volunteer programs, we make an effort to send an email fairly often to our current volunteer corps to prompt them to forward the email to any friends or family that might be interested, so we can make that connection. So I think it is not only up to the volunteer to invite people into their world and experience it with them. I think it's also on the organizations to make some outreach effort to be like, hey, you know, we have these shows coming up, we have some availability. If you have friends or family who are interested, share with them, and we'll see how we can get them involved, maybe as a one-off opportunity. We haven't done it as much at Strathmore, again, because I'm still new, so Daniel's like, what are you talking about? But I think, you know, there's opportunities, you know, to spark that, like, oh, my friend did mention this, here's an email I can just send to her and she can sign up, or he or whoever. So I think it's up to us as well to help spark that invitation.
Wanda.
I guess I'll jump in briefly on this one.
Oh, sure.
I'm just thinking about the group on the call today from AU staff members, just that idea that if we as staff members can relate to our colleagues, to our peers, and say, hey, I know the pressure that you're under at work. I know the busy seasons, the peaks, the valleys, things like that, and just definitely sharing the feelings that you get after you volunteer, but then saying this is a manageable process if you approach it like this, as far as time commitments and everything. So just connecting with folks one-on-one to really say, I know that you give a lot to your work. I know that you care a lot about our students. I know that you might feel like you don't have any more time to give, energy to give, but you may be able to if you approach it this way.
I think Sarah was going to say something. Oh.
I was just going to say, I agree with you, Wanda. Just invite them. It's so simple, but it's very, at least from my experience, it's very few and far between when you're just asked to do something like that. And flattery does get you a lot of places. So just engaging in a good, personal, connected conversation and inviting them along. And like you say, just let them experience the magic, and it usually gets them involved. And you know what, if not, it's a good conversation. It's an interesting conversation to have with a friend to say, hey, that wasn't the same experience for you as it is for me. I wonder what else we could try out, or you could try out. And that's just, you find out more about a friend, which is fun.
Daniel, do you have anything else? I think we have, what, a few more minutes left?
We have 5 minutes left, and I suppose just one question I'd like to get to is about how COVID has impacted the current organizations that you volunteer with. At this time, just from a community sense, if there's anyone who's currently on the call, I know we may have folks that are thinking about volunteering for the first time, and we may have seasoned volunteers on the call. If there's anyone on the call who would like to post the website or the organization where they volunteer, that might be a way that if you're reading the chats, you can connect with colleagues across AU and learn more about their organizations as well. So if you currently volunteer, you're welcome to put those organizations in the chat. And then Wanda, I suppose if we could talk a little bit just about the impact of COVID and then round it out.
Okay, I was like, one of my organizations, the impact of COVID has been that we normally have our annual summit at the end of April. So I was saying at the beginning of the call how we had to do it virtually. You know, instead of over 4 days, we're doing it over 4 weeks. So that's been a challenge, but it's going pretty well. So that's one impact. But people miss the social piece of the conference and, you know, meeting up. I mean, so there's some drawbacks, but at least we're moving forward. So for me, it's reminded me how resilient and progressive this organization is. So I'm pleased by what we accomplished in a short time. So, Sarah, Allison.
Sure. So, you know, obviously Strathmore is closed right now, along with many other larger venues and performing arts venues. And at the moment, we don't expect to get back to fully reopen for some time, because I think organizations like that will be in phase 3. But I think, you know, we are, as an organization, we are making a concerted effort to keep in touch with our volunteers. So our front of house manager actually just got done calling all 400 active volunteers one-on-one phone call to check in and make sure everyone's okay. And then we're doing monthly newsletters still. And then, you know, we had to cancel our annual appreciation for them. So we're going to start brainstorming how we can do something digitally or virtually, or put together like a digital package to share with them so they still feel that love and appreciation that we have for them. And I think we'll look to them as we get more towards reopening. We'll look to them for, you know, what will make them feel safe coming back. What have we not thought of that our volunteers need to come back, not just our audience. So we'll start looking to them for their input once we, you know, put together a survey and get closer. But yeah, so for us, it's been about continuing communication and appreciation in this time when we can't see them and physically say, like, thank you for being here, we appreciate you. Because we did have half a season and they still were here for that, and we don't want that to go unnoticed.
Sarah?
So Children's National Hospital is not closed, as you can imagine, but the volunteers are not coming in. For infection control reasons, it doesn't make sense to increase the risk to our patients and our amazing staff to have us in, but we can volunteer virtually. So we can assist by reading, like recording storybooks and sending those to the kids so they can watch them on tablets. We help organize games. We have a radio station in Children's National, actually, so we help organize the games on the radio station. We can still donate. So Children's National, like many medical places, does need PPE. There's a lot of information on the website if you're someone who can access that. And we're staying together by connecting on Zoom and being present with each other, sending messages of support. A lot of us have contacted the contacts we know to help feed our nurses and doctors during their shifts. But you know, it's a really wonderful place. We don't know when we're gonna get back there, but that doesn't mean the work stops. The coolest thing we do is we help with telehealth visits. So we'll pop on just like this before a telehealth visit and explain to caregivers or the patient what will happen and how it's different from their experience in the hospital or at one of our outpatient centers. And we will just help facilitate that within HIPAA guidelines and just have a little fun. Sometimes we play a little virtual snakes and ladders or some trivia, just help them relax because it's kind of weird being in this space with each other sometimes. So there's still lots of ways that we can be involved. We're still a big community. We're excited to get back in there, let me tell you. I can't wait to wear my smock again.
You are clearly volunteering at the right place. So let me
Yeah, I
just
love it.
Daniel.
Well, we are at 2:45, so I just want to say thank you again to Wanda and our panelists today for this conversation. We have recorded this session, so we will make sure that it gets released with the transcript as well as the information that's in our chat box. So please be on the lookout for that. Please tell your colleagues that you came to this presentation today and that you're super excited. Get their feedback about places to serve and volunteer. And it will make AU a better place, DC a better place, and really grateful for everyone for joining us today. Please be safe, be well. Okay.
Thank you, Daniel. Thank you for everyone who joined the call.
Thank you all. Have a wonderful afternoon.
All
Happy
right.
Staff Appreciation Week.
All right, thanks.
Thank
Bye.
you.
Bye.
Terrific.